Hi, everybody. Today we're going to talk about acute stress disorder and post-traumatic stress disorder. And we're going to make some distinctions between um, anxiety conditions and stress-related disorders. So this is basically going to be a primer for PTSD and acute stress disorder. Okay, so if a person experiences a trauma, it is not uncommon for them to become either anxious or depressed, but for some people, they resolve it on their own. For other individuals, this trauma could result in a psychological disorder or one of a couple psychological disorders. The first one being acute stress disorder, and the second one being post traumatic stress disorder. And if you were to think about why I'm using the word stress versus anxiety, well, anxiety oftentimes comes from an uncertain place. We oftentimes don't know what the event that triggered the anxiety is. When it comes to acute stress disorder and post-traumatic stress disorder, the trauma, that experience is clear. So with stress disorders, these are clear to anyone who experienced that event that that is the source of their distress. So with anxiety, the source of the distress is oftentimes unknown. When it comes to stress-related conditions, the source of the trauma is clear, and anyone who experienced that traumatic event would have some of these physiological responses. So let's distinguish between the two. So the first psychological disorder we're going to talk about is acute stress disorder. Now, in order to be diagnosed with acute stress disorder, you must have the symptoms we're going to talk about. They must occur within 4 weeks of whatever the traumatic event is. However, they must resolve themselves, whatever the symptoms are, within 1 month of them starting. So that's acute stress disorder. When it comes to post-traumatic stress disorder, we don't require the symptoms to start within 4 weeks of the event. It could start at any time. And the symptoms can persist longer than 1 month. And that is oftentimes the case with post-traumatic stress disorder, that it stays much longer than 1 month. So when we think about the mapping of the two, it's not shocking then that some cases of acute stress disorder will actually convert into post-traumatic stress disorder. And we estimate that it's about 80% of the cases. What does that mean? That means that when we have acute stress disorder, 4 out of every 5 people who are diagnosed with acute stress disorder are unlikely to resolve whatever the distress is within 1 month of experiencing the trauma. Now, for symptomology, this checklist comes from the DSM-5. So a person is exposed to some form of a traumatic event, whether it be death or threatened death. It could be severe injury. It could be a sexual violation. It could be a large-scale natural disaster, such as an earthquake or a hurricane or whatnot, right? So the person experiences a traumatic event, and they must have at least one of the following intrusive features. They must have a recurring memory or distressing memory of the event. They have dreams about the event. They might have dissociative experiences about the event. They might have flashbacks, right? Now, flashbacks happen in the wakeful state. They might have nightmares in the dreaming state or the sleep state. So this person is going to re-experience their trauma in one way or another. They also have to go to lengths to avoid whatever the events are that lead to reliving the trauma. So if a person experienced, let's say, a natural disaster and they had a tsunami, they might avoid going to the beach because that might trigger or elicit them reliving the traumatic experience of a tsunami, right? We also tend to see with some people that they have reduced responsiveness, so they tend to become more detached or removed from other people, and they experience things like guilt, anxiety, etc. So people who have PTSD or have acute stress disorder, they oftentimes report having difficulty sleeping, and that could be going to sleep, it could be maintaining their sleep, it could be having disrupted sleep due to nightmares, and so forth. There's increased irritability around the trauma. It could interfere with your focus or concentration. A person might become hypervigilant as it relates to the issue. So they might have their head on a swivel, constantly looking around to see if they're in danger. And subtle triggers might result in an exaggerated startle response, like jumping. So these are the symptoms. Again, if the symptoms are less than a month in duration, we're looking at acute stress disorder. If the symptoms maintain for more than a month, we're talking about post-traumatic stress disorder. So what is the epidemiology? Well, when we think about acute stress and post-traumatic stress disorder, the first thing I want to impress upon you is that it can occur at any point of one's life, right? So it can occur in early childhood all the way to late adulthood. We also know that roughly 3.5% of the US population is affected by a stress-related disorder in a given year. And across the lifespan, it's about 7 to 9% of the US population will experience a stress-related disorder. We also see that women have higher rates of acute stress and post-traumatic stress disorder, a little over 2 to 1. So about 20% of women in their lifespan will report some kind of stress-related condition, and about 8% of men. When we look at ethnicity, there's no major ethnic differences when it comes to PTSD. So this is not more common in one group over another. Now, what's interesting is if we look at people who are seeking treatment, that tells you the level of distress that this condition is causing. And 2 out of every 3 people who are diagnosed with acute stress or post-traumatic stress disorder wind up seeking treatment in their lifetime. That's how debilitating PTSD can be. So when we think about, well, what are some of the common causes, and I'm going to do a deeper dive on this, but people can develop PTSD due to combat, war. It could be due to disasters, some form of abuse or victimization. Any number of these factors could trigger a stress-related disorder. So that's what I have for us today in this particular video. I'm going to make a separate video going into the sources of post-traumatic stress disorder, and then other ones related to treatment and so forth. But I wanted to make sure that I package it up nicely for you. So I'm going to stop there and hope you enjoy, and to be continued.